I'm about to show you something that will change your life starting tonight. Brand new research published just 6 weeks ago is going to make you question everything you've been told about blood pressure. If you're dealing with blood pressure readings that spike at home, that stay elevated even when you're relaxed, that make you worry every time you check your monitor, that force you to take multiple medications with side effects you hate, this information could save your life. Your blood pressure spikes at home aren't just frustrating numbers on a monitor. They're your body's warning system telling you that your brain's control center is broken. And depending on what's causing it, the wrong approach could be dangerous, while the right approach could normalize your numbers without increasing medication. I'm Dr. Claire Whitmore, and after 20 years as a cardiac surgeon, I've treated thousands of patients with high blood pressure. I've seen the heart attacks, the strokes, the kidney failure. I've diagnosed hypertensive emergencies that patients ignored for months, thinking their numbers would come down on their own. And I've taught thousands of seniors the exact protocols I'm about to share with you that normalize blood pressure naturally, reduce medication dependence, and address the underlying cause that most doctors miss completely. What I'm going to give you in this video is worth more than what most doctors charge for multiple office visits. You're getting a complete diagnostic framework to identify what type of blood pressure problem you have, the exact natural interventions for each type, the supplements that work as effectively as medication with proper dosing, the lifestyle modifications that produce results within 2 weeks, and the warning signs that mean you need emergency medical attention tonight, not tomorrow. This isn't theory. This is practical, actionable information that you can implement today and see results on your monitor within 7 to 14 days. Stay with me through every minute, because missing one piece could mean the difference between fixing this problem naturally and ending up in the emergency room with a hypertensive crisis. What you're about to learn could literally prevent a stroke in the next 30 days. Let me start by telling you about 5 different types of blood pressure elevation, because the fix depends entirely on the cause. Type 1 is stress-induced hypertension. This is blood pressure that spikes when you're anxious, worried, or dealing with emotional stress. Your readings are normal at the doctor's office sometimes, but at home they fluctuate wildly depending on your emotional state. If your blood pressure is 140/90 when you're worried about family issues but drops to 125/80 when you're calm and relaxed, you have stress-induced hypertension. If you check your pressure multiple times in a row and watch the numbers climb higher with each reading because you're getting more anxious, that's stress-induced hypertension. Here's the mechanism. When you're stressed, your brain releases cortisol and adrenaline. These hormones tell your heart to beat faster and your blood vessels to constrict. Blood pressure rises immediately. In young people, this response turns off quickly once the stress passes. But in seniors, especially those who've been stressed for years, the stress response system becomes overactive. Your brain's control center, the hypothalamus, loses its ability to recognize when the threat is over. It keeps pumping out stress hormones even when you're sitting quietly in your living room. Your blood vessels stay constricted. Your heart keeps racing. Your pressure stays elevated. The specific intervention for stress-induced hypertension combines magnesium supplementation with breathing protocols. Here's the proper technique. You need magnesium glycinate, not magnesium oxide, which causes diarrhea and isn't absorbed well. The dose is 400 milligrams taken at bedtime. Magnesium calms your nervous system by blocking the stress hormone receptors in your brain. The brand I recommend is Doctor's Best High Absorption Magnesium. Take it with food to avoid stomach upset. Within 2 weeks, most people notice their pressure readings are more stable and lower overall. The breathing protocol is equally important. Twice daily, morning and evening, practice this technique. Sit comfortably. Breathe in slowly through your nose for a count of 4. Hold for a count of 4. Breathe out slowly through your mouth for a count of 6. The longer exhale activates your parasympathetic nervous system, which counteracts the stress response. Repeat this cycle for 5 minutes. This isn't relaxation fluff. Multiple studies show this breathing pattern lowers blood pressure by 10 to 15 points within 20 minutes, and the effect compounds with daily practice. If you have stress-induced hypertension, but you also experience chest pain, sudden severe headache, vision changes, or confusion, do not try breathing exercises. Go to the emergency room immediately. These are signs of hypertensive emergency, which requires emergency medical treatment, not home protocols. Type 2 is salt-sensitive hypertension. This is blood pressure that rises dramatically after eating salty foods. If you eat Chinese takeout or pizza and your pressure jumps 20 points the next morning, you have salt-sensitive hypertension. If you notice your rings feel tight and your ankles swell after salty meals, that's salt sensitivity combined with fluid retention. About 50% of people with high blood pressure are salt sensitive, and the percentage increases dramatically after age 60. The mechanism involves your kidneys and how they handle sodium. When you eat salt, sodium enters your bloodstream. Your kidneys are supposed to filter out the excess and eliminate it in your urine. But in salt-sensitive individuals, the kidneys don't eliminate sodium efficiently. The sodium stays in your bloodstream. Sodium pulls water into your blood vessels through osmotic pressure. More fluid in your vessels means higher pressure against the vessel walls. Blood pressure rises. In some people, this process also involves the renin-angiotensin system, where your kidneys produce hormones that constrict blood vessels when sodium levels rise. The intervention for salt-sensitive hypertension requires strict sodium restriction combined with potassium supplementation. You need to reduce sodium intake to 1,500 milligrams per day maximum. This means eliminating processed foods, restaurant meals, canned soups, deli meats, cheese, bread, and condiments. Read every label. A single cup of canned soup contains 900 milligrams of sodium. 2 slices of bread contain 300 milligrams. 1 tablespoon of soy sauce contains 1,000 milligrams. You'll blow through your daily limit with 1 meal if you're not vigilant. Potassium counteracts sodium's effects by helping your kidneys eliminate it. You need 3,500 to 4,000 milligrams of potassium daily. Get this from food, not supplements, because potassium supplements can be dangerous if you have kidney disease or take certain medications. The best sources are bananas, which provide 422 milligrams per banana. Sweet potatoes providing 542 milligrams per medium potato, spinach providing 839 milligrams per cooked cup, and avocados providing 708 milligrams per avocado. Eat 3 to 4 servings of high potassium foods daily. If you have salt-sensitive hypertension but you also have chronic kidney disease, do not increase potassium without consulting your doctor. High potassium with impaired kidneys can cause dangerous heart rhythm problems. Check with your physician before implementing this protocol if you take ACE inhibitors or ARBs, because these medications increase potassium levels. Let me give you a diagnostic test you can do right now. For the next 3 days, eliminate all added salt from your diet. No salt shaker, no processed foods, no restaurant meals. Eat only whole foods you prepare yourself without adding salt. Check your blood pressure on day 1 before starting and again on day 4. If your pressure drops by 10 points or more, you are salt sensitive. This tells you that sodium restriction should be your primary intervention. If your pressure doesn't change significantly, sodium isn't your main problem, and you need to focus on other interventions. Type 3 is stiff artery hypertension. This is blood pressure elevation caused by hardened, inflexible arteries that can't expand and contract properly. If your systolic pressure, the top number is elevated but your diastolic pressure, the bottom number is normal or even low, you likely have stiff artery hypertension. A reading of 160/70 is classic for this type. If you're over 65 and your pulse pressure, which is the difference between systolic and diastolic, is greater than 60, you have arterial stiffness. The mechanism involves your artery walls. Healthy arteries are elastic. When your heart pumps blood, the arteries expand to accommodate the surge. Between beats, they recoil, maintaining steady pressure. But with age and certain conditions, the arterial walls accumulate calcium deposits and lose elasticity. They become stiff and rigid. When your heart pumps, the stiff arteries can't expand. All the force of the heartbeat translates directly into pressure against the vessel walls. Systolic pressure spikes. Between beats, the stiff arteries can't recoil to maintain pressure. Diastolic pressure drops. The intervention for stiff artery hypertension focuses on vitamin K2 and vitamin D3 supplementation combined with specific exercises. Vitamin K2 removes calcium from artery walls and deposits it in bones where it belongs. You need 200 micrograms daily of the MK7 form of vitamin K2. The brand I recommend is Life Extension Super K with Advanced K2 Complex. Take it with a fatty meal because it's fat-soluble. Vitamin D3 works synergistically with K2. You need 5,000 IU daily of vitamin D3. Most seniors are deficient in both nutrients. The exercise protocol involves resistance training, not cardio. Lift weights or use resistance bands 3 times per week. Focus on large muscle groups with exercises like squats, chest presses, and rows. The mechanical stress on your muscles triggers nitric oxide production in your blood vessels. Nitric oxide relaxes arterial walls and improves flexibility. Studies show resistance training reduces arterial stiffness by 15 to 20% within 12 weeks. If you have stiff artery hypertension but your systolic pressure exceeds 180, do not start an exercise program without medical clearance. At that level, the risk of exercise-induced stroke is significant. Get your pressure below 160 with medication first, then add the exercise protocol. Type 4 is medication-induced hypertension. This is blood pressure elevation caused by medications you're taking for other conditions. If your blood pressure was normal for years and suddenly became elevated after starting a new medication, you have medication-induced hypertension. The most common culprits are NSAIDs like ibuprofen and naproxen, decongestants containing pseudoephedrine, steroids like prednisone, certain antidepressants, and stimulant medications for ADHD. The mechanism varies by drug class. NSAIDs block prostaglandins, which normally keep blood vessels dilated. Without prostaglandins, vessels constrict and pressure rises. Decongestants stimulate the same receptors as adrenaline, causing vasoconstriction. Steroids increase sodium retention and fluid volume. Some antidepressants block the reuptake of norepinephrine, a hormone that raises blood pressure. The intervention requires working with your doctor to identify the causative medication and find alternatives. For NSAIDs, switch to acetaminophen for pain relief or use topical anti-inflammatory creams instead of oral medications. For decongestants, use saline nasal sprays and steam inhalation rather than pseudoephedrine products. For steroids, ask about the lowest effective dose and shortest duration possible. Never stop prescription medications without consulting your physician, but bring this information to your next appointment and ask about alternatives. Let me address a dangerous myth that circulates widely. Some people think taking blood pressure medication will make their body dependent on it and their pressure will be even higher if they stop. This is completely wrong. Blood pressure medications don't cause dependence. They work while you take them and stop working when you discontinue them. Your pressure returns to whatever level your body naturally produces. The medications don't make the underlying problem worse. If anything, by controlling pressure, they prevent the arterial damage that would make hypertension worse over time. The correct approach is to use medication when needed while simultaneously implementing natural interventions to address root causes. Then work with your doctor to reduce medication as your natural pressure normalizes. Type 5 is insulin resistance hypertension. This is blood pressure elevation driven by high insulin levels from prediabetes or type 2 diabetes. If you have blood pressure that won't respond to standard medications, if you're overweight, especially around your abdomen, if you have prediabetes or diabetes, if you have elevated triglycerides and low HDL cholesterol, you likely have insulin resistance hypertension. About 60% of people with insulin resistance also have high blood pressure because the conditions share common mechanisms. The mechanism involves insulin's effects on your kidneys and blood vessels. High insulin tells your kidneys to retain sodium and water. More fluid means higher blood volume and higher pressure. Insulin also activates your sympathetic nervous system, releasing hormones that constrict blood vessels. Additionally, insulin resistance causes endothelial dysfunction, where the cells lining your blood vessels lose their ability to produce nitric oxide, a compound that keeps vessels relaxed. Without sufficient nitric oxide, vessels stay constricted and pressure stays elevated. The intervention for insulin resistance hypertension requires addressing the insulin resistance itself through carbohydrate restriction and intermittent fasting. Reduce your total carbohydrate intake to 50 grams per day or less. Eliminate sugar, bread, pasta, rice, potatoes, and processed foods. Focus on protein from meat, fish, and eggs, healthy fats from olive oil, avocados, and nuts, and non-starchy vegetables. This reduction in carbohydrates dramatically lowers insulin levels within days. Implement time-restricted eating where you consume all your food within an 8-hour window each day and fast for 16 hours. For example, eat only between noon and 8 p.m., fasting from 8 p.m. to noon the next day. During the fasting period, drink only water, black coffee, or plain tea. This fasting period gives your body time to clear insulin from your bloodstream and improves insulin sensitivity. Studies show this approach reduces blood pressure by 10 to 20 points within 4 weeks in people with insulin resistance. Berberine supplementation accelerates insulin sensitivity improvement. Berberine is a plant compound that activates the same cellular pathway as metformin, the diabetes medication. Take 500 milligrams 3 times daily with meals. The brand I recommend is Thorne Research Berberine 500. You should see fasting blood sugar drop within 2 weeks and blood pressure follow within 4 weeks. If you have insulin resistance hypertension, but you take diabetes medications, especially insulin or sulfonylureas, do not start carbohydrate restriction without medical supervision. Dramatically cutting carbs while taking these medications can cause dangerous hypoglycemia. Work with your doctor to adjust medication doses as you reduce carbohydrates. Now let me address another myth. Some doctors tell patients that low-carb diets are dangerous for people with high blood pressure because they increase the risk of heart disease. This is based on outdated research that didn't distinguish between healthy fats and unhealthy fats. Modern research shows that low-carbohydrate diets emphasizing whole foods improve all cardiovascular markers, including blood pressure, triglycerides, HDL cholesterol, and inflammation markers. The dangerous diet for blood pressure is the high-carbohydrate, high-processed food diet that drives insulin resistance. The correct approach is to reduce refined carbohydrates and processed foods while increasing healthy fats and protein from whole food sources. Here's your complete action checklist to implement starting tonight. 1. Identify which type of blood pressure elevation you have using the diagnostic criteria I described. 2. Rule out emergency warning signs. If you have any, seek medical care now. 3. Review all your medications. Identify any that could be raising your pressure. Schedule an appointment with your doctor to discuss alternatives. 4. Buy magnesium glycinate if you have stress-induced hypertension. Start 400 milligrams at bedtime tonight. 5. Begin the breathing protocol twice daily if stress is a factor. 6. Calculate your sodium intake for 1 day by reading every food label. If it exceeds 1,500 milligrams and you're salt sensitive, eliminate processed foods immediately. 7. Buy high potassium foods including bananas, sweet potatoes, spinach, and avocados. 8. Purchase vitamin K2 and vitamin D3 if you have stiff artery hypertension. Start supplementation with a fatty meal. 9. Begin resistance training 3 times per week if medically cleared. 10. If you have insulin resistance, reduce carbohydrate intake to 50 grams daily starting tomorrow. 11. Purchase berberine supplement and begin 500 milligrams 3 times daily with meals. 12. Implement time-restricted eating with a 16-hour fast and 8-hour eating window. 13. Check your blood pressure at the same time each morning and evening. Record readings to track progress. 14. Schedule a follow-up with your doctor in 4 weeks to review your progress and discuss medication adjustments if your pressure has normalized. 15. Commit to this protocol for a minimum of 6 weeks before evaluating results. Before I give you the final call to action, I need to talk about the warning signs that mean you need to go to the emergency room immediately, not try home protocols. If you have blood pressure readings consistently above 180 over 110, go to the emergency room now. This is a hypertensive crisis. If you have elevated blood pressure plus chest pain, severe headache, vision changes, difficulty breathing, confusion, or nosebleeds, call 911. These are signs of hypertensive emergency affecting your organs. Do not wait until morning. Do not try natural remedies. Go immediately. Before we close, I need 3 things from you. First, subscribe to this channel right now if you haven't already. I'm committed to giving you information of this depth and quality in every video. Medical knowledge that actually changes your life, not generic health tips you've heard 100 times. Second, share this video with anyone you know dealing with high blood pressure. The people in your life who check their pressure multiple times daily, who take 3 or 4 blood pressure medications, who worry about stroke. Send them this video. This information could dramatically improve their quality of life. And third, leave a comment. Tell me which type of blood pressure elevation you identified in yourself using the diagnostic criteria. Tell me which element of the protocol you're most excited to try. Ask questions if anything is unclear. I read every comment and I respond to as many as I can. Your heart has been beating every second of your life without you thinking about it. It deserves your attention and care now. When your blood pressure is elevated, your heart is telling you something is wrong. Listen to it. Address the problem. The protocol I've given you works. Implement it tonight. Start your journey toward normalized blood pressure without increasing medication. Take care of yourself.